Well, we finished the day in the OR, and I want to talk about one of the more common things that we encounter. We do a lot of breast implant surgery in this practice, but sometimes when people have had implants for quite some time, they may notice some changes going on. Many times that could be something called a capsular contracture. A capsular contracture is where the scar tissue that formed around the implant starts to get harder. It can happen for a number of reasons, but usually it's something that we see later on. It's something that we see because maybe the implant is ruptured and the body is just trying to wall it off a little bit more. But the main thing is that the implant becomes a little bit harder. It can actually then look distorted, and left untreated go on to be painful. So there's several different grades of capsular contracture, and when something gets to where it's distorted or where it's painful, that's when somebody should really be addressing it. There are definitely different ways to address it. The main reason that we're going to do a surgery for a capsular contracture is that we want to take out the hardened scar tissue as well as the implant and start fresh again. Then we're creating a new pocket, and then we're putting a brand new implant in. And we're doing everything that we can to try to minimize a recurrent capsular contracture, meaning that there's no blood left in the pocket, of course, and that we're using antibiotic irrigation at the time of the surgery. We're also, when we're putting in the implant, we're using a Capsular funnel, which looks like a pastry bag that the funnel then allows the implant to be placed into the pocket without anybody touching it against the skin, or it's called minimal touch technique, so it's really not being manipulated. All of these things will help prevent a recurrent capsular contracture.